Hi, in this video, I am going to be talking about certain medications that we may not want to have you take during your breast cancer treatment. First of all, the most important thing is just talk with your medical team about any medications, supplements, over-the-counter medications that you're taking. Your pharmacist and your medical oncologist together can make sure that you're not on anything that will interfere with your treatment. It's really common not to want to tell your medical team about supplements that you're on, but it's really important that you find a medical team where you can talk about all your concerns, including things that you might want to take the best care of yourself. In general, we recommend that people not take supplements or high doses of vitamin when they're on chemotherapy and endocrine therapy. The reason is, in particular, chemotherapy works through oxidation of cancer cells, and if you're taking high doses of vitamin C, for example, this is an antioxidant, and we would rather not protect those cancer cells from the chemotherapy. You're going through all of this, and the last thing we want to do is let those little cancer cells hide out. So although this hasn't been shown in large studies of people, we generally recommend that you not take supplements. There are epidemiologic data suggesting that supplements may undo the benefits of chemotherapy, and there are certainly animal models, but we don't have clinical trials where people were randomized to take supplements versus not. So just a word about supplements with chemotherapy. We don't recommend them. You could talk about starting them after chemotherapy with your medical team. A couple other things to know about if you're on a blood thinner because you've had a blood clot in the past or a pulmonary embolus. Around the time of surgery, your medical team will have you stop your oral anticoagulants, probably go on a blood thinner that's given by injection, which is more quickly reversed when you have your surgery. We certainly don't want to expose you to any risks when you come off your anticoagulation, but we also don't want you to have a lot of bleeding or bruising around the time of your surgery. Methotrexate is a chemotherapy drug that we give as part of a regimen called CMF. Methotrexate can, in higher doses, hurt the kidneys, and so we want to make sure that you're not on any other medicines that can hurt the kidneys. So your medical team will look at your meds and make sure that your medications are safe to continue during chemotherapy. I'm next going to talk about some data about tamoxifen and antidepressants. There are some large studies that suggest that some antidepressants may decrease the effectiveness of tamoxifen. Tamoxifen is an interesting drug. It's a prodrug that's converted by an enzyme in your body to the active drug. So tamoxifen is converted by an enzyme to endoxifen. We haven't yet found a way to create just straight endoxifen. So your body converts tamoxifen to the active form of the drug. Some commonly used antidepressants can interfere with that enzyme, so tamoxifen is not converted to the active drug. If you are on an antidepressant for depression or other serious mental illness, tamoxifen may be decreased in effectiveness and you may not want to stop the antidepressant. If you're on an antidepressant for other things, migraine headaches or hot flashes or one of the many other things we give these antidepressants for, you may want to switch to a different antidepressant that won't interfere with tamoxifen. Your medical doctor and your pharmacist will know which drugs are the right ones. I just want to raise this as an important thing to talk about with your medical team. I've covered a lot in this video. If you have any questions or comments, drop a comment below. You can like this video, which will help you find other videos that we produce. And if you subscribe, it will do the same thing. Liking actually helps other people who might have the same questions as you find this video. And as usual, you can visit yerbba.com for your personalized report to learn more about the treatment options you might hear about being offered to you as you go through breast cancer and its treatment.